How many of you have ever received a health care bill that you did not understand? Raise your hand. All right, so I see a lot of hands raised. Pretty much everybody. And when you don't understand it, you're more reluctant to pay, and that's a bad outcome for doctors and hospitals. That's a problem that we solve today at Secure Health Pay. Let me tell you how it all got started. My wife and I were driving home from Piedmont Hospital after she had just given birth to a beautiful, wonderful baby girl. And we got home 30 to 45 days later after a lot of sleepless nights. We were knee-deep in baby bottles and diapers, and something else arrived. A lot of health care bills. People always told me that girls were going to be more expensive than boys. I just didn't realize that day one this was going to be the case. So there was a lot of confusion, and I had a hard time understanding what to pay and when to pay. That was really the birth of also Secure Health Pay. So the first thing we did is we backed up and we looked at the market. Is it a big market? And the answer to that is absolutely yes. There's $290 billion today that are transacted between patients and providers, most of which is paper-based. And it's growing to $540 billion with the presence of deductibles in the marketplace and the higher cost of health care. That $290 billion is a big nut. I mean, if you just think about that in and of itself, that's how much American Express processes in 1 year alone. So we looked at that growth and said, who has the pain involved with this growth? And the answer was very interesting. We looked at that pain, 27%, or if you look at hospitals and doctors and back it down just on a doctor basis. Let me explain this graph. Part of how they get paid is public insurance, Medicare, Medicaid. Part of how they get paid is private insurance, Blue Cross Blue Shield, and the patient payments. Now, just a few years ago, that pie chart was just a sliver of what it is today. Today, it's 27% of what a doctor will take home in terms of revenues. And they can't collect it. Over half of it is uncollectible. So it's this big growing market with lots of pain, and the problem's getting worse, not better. So then we took another step back and said, well, who would pay for this solution? And after looking at ways that we could put a dent in that patient AR, we realized independent physician groups or doctors and community hospitals. Now, what are they paying for? We've created for the first time a patient payment clearinghouse. So we can take everything from the patient, your account number, your social security number, your banking account information, the amount due, your phone number, and bundle it up with what we call a secure health code and transact that over to the provider and their bank account in a very HIPAA and PCI compliant way, and give them another report that allows them to reconcile this back to their practice management health information systems software and post automatically. We can allow a patient to pay any doctor. Now, what does that mean from a sales perspective? Today, we're tracking at a low seven-figure run rate. If you look at those two bottom bar graphs, that just means that 95% of our revenue is recurring today. And as one of our most recent customers told me when he was about to send in our contract, he said, Bird, I got to get this right, because once you start giving me money or depositing money to my bank account every single day, I can never tell you to go away. So it's very sticky. The blue states are where we are, and if we do nothing else this year, over 750,000 patients will have access to Secure Health Pay. These are some of our customers today, and this is why they're signing up. Number one, 95% of the time when someone uses their patient wallet, which is our application, a healthcare provider gets paid. Number two, it occurs in 25 days. If Secure Health Pay isn't there, that payment usually incurs 45 to 60 days. Even better, 85% of the time, those payments are in full. Without Secure Health Pay, it's usually around 30%. And another exciting fact is we're processing this all through Secure Health Pay. We charge one flat rate for all transactions, so no more trying to understand your merchant statements and the fees associated with those. Now, a lot of people call us a PayPal for healthcare. In this town, it's probably more appropriate to say check-free. And if you think about what we're solving for the patient, we're giving them the convenience of not just paying doctors who have signed up, but also doctors who don't even know who we are. We can get those payments electronically to them. But that convenience also gives us some flexibility in that we can, it gives us some flexibility in that we can deliver those payments as leads to the new providers. And so if you're on your boards worried about sales cycles and sales cost, watch this. With our growth model, we sign up a doctor who gives us access to some patients. Some of those patients use their patient wallet to pay other doctors, and those doctors sign up and give us access to more patients, some of which who again give us access to more doctors. We've got a great team who's leading the charge in all this, who have experience with venture-backed expense management and healthcare IT companies that are right here in Atlanta. And when I think about Atlanta, I think again about, if you think about the strengths of Atlanta, it's healthcare, IT, and fintech. You put those two exciting pieces together, and the intersection of that is Secure Health Pay that's delivering value every single day to patients in terms of convenience and also to providers in terms of cash flow. We are thankful that you're here today. We're currently raising a Series A round of $3.5 million in early first quarter of next year. And we'd love to meet you at outside or come by and sign up for your very own patient wallet. Thank you.